Welcome to part 3, where we're going to focus on diarrhea. Diarrhea is defined as increased frequency of bowel movements with altered consistency of stool. This would be more than 3 bowel movements per day, and the consistency is much more liquid than normal. What's happening with diarrhea is either the bowels are reabsorbing too much water, making it more watery than it should be, or peristalsis is moving so fast that there isn't enough time for the bowels to absorb any water, so it's not formed. Diarrhea is interesting because it can be an acute issue, a chronic issue, or it can be a persistent issue for some people. This is why it's so important to ask people what their normal bowel movements look like and what their frequency is and how often they go. Some people will say they have diarrhea because they had more bowel movements that day, and some will say they have diarrhea only when they have pure water bowel movements. Diarrhea can be caused by many things, including infections, medications like antibiotics, tube feeding, metabolic and endocrine disorders, certain diseases, stress, and even changes in diet and exercise. A thorough health history can help us determine what the cause of the diarrhea is. When we're assessing someone with diarrhea, we'll find out that they're having more bowel movements than normal for them. They will also state that the consistency of their stool has changed, typically to a much more liquid consistency than normal. On the stool form scale, we would see types 5 through 7. Diarrhea often has abdominal cramping and abdominal distension. Diarrhea can also have borborygmus bowel sounds, which are very loud, very fast bowel sounds, like you can hear the person's stomach churning, sometimes without even putting your stethoscope on their abdomen. Diarrhea also causes people to have anorexia, not the anorexia where the person won't eat because they want to lose weight, but the type of anorexia where they can't eat. They feel too sick to eat anything. And sometimes the diarrhea can make the person dehydrated, so they feel extra thirsty. Diarrhea is usually associated with painful, urgent, spasmodic contractions of the anus where they feel like they're going to have a bowel movement that exact second. And because diarrhea is urgent, it's a liquid bowel movement, it can cause the person to sometimes have incontinence or the inability to control their bowels. They feel like they have to jump up and run straight to the toilet right away. This can cause safety issues in healthcare where we have them hooked up to lines and tubes, the room may be dark, or the surroundings may be unfamiliar. Some diagnostic tests that can do for diarrhea include blood work, looking for white blood cells for a possible infection, chemistry levels to check for electrolyte and fluid imbalances, stool examinations, especially looking for bacteria, parasites, and blood. And then how thorough of diagnostics a provider will actually do depends on how symptomatic or how sick the patient is with their diarrhea. Usually, diarrhea is pretty time limited and resolves itself with little complications, but sometimes, depending on the cause, diarrhea can have major complications that can even result in death. Unfortunately for healthcare workers, people come to a facility with diarrhea because it hasn't been time limited and they are having complications. For us, we need to know that these patients are most likely going to be dehydrated. It's very hard to get enough liquids by mouth to overcome the amount of liquids being lost from diarrhea. And with this loss of fluid comes loss of electrolytes and nutrients. These electrolyte imbalances can become severe enough to cause cardiac dysrhythmias, which are when the heartbeat doesn't beat correctly and it starts beating abnormally. Potassium and magnesium are the big electrolytes that keep the heart beating properly, and we lose a lot of potassium with diarrhea. If potassium goes too low, we die. Another complication of diarrhea is skincare issues that can lead to skin breakdown. It can be very hard for people to keep their rectal skin clean if they're having so much diarrhea. The liquid stool also has digestive enzymes in it that don't only digest food, they can digest skin if it gets on the skin for too long. And if you see from this picture, it can get very bad. So remember that nursing process. If we have a problem, our outcome is going to be the opposite of the problem. With diarrhea, the patient is not having formed regular bowel movements. Our outcome would be that the patient has regular formed bowel movements. We may have other outcomes related to the diarrhea depending on what kind of complications they're having, so it's not uncommon for a patient with diarrhea to have more than one priority problem. We do want to make sure a patient rests. Too much activity can cause increased peristalsis and cause more diarrhea. We also need to alter the patient's diet as well as educate them on diet choices while they're having diarrhea. Dairy products, grains, and fiber can all make diarrhea worse, so we try to have patients avoid these. We also try to have them avoid foods that irritate the GI tract like caffeine, carbonation, spicy food, hot and cold foods, so we don't stimulate peristalsis. Bland foods are the best. We want to have the patient drink water and nothing sugary. Often, these patients receive IV fluids for hydration because anything they take orally causes them more diarrhea. We want to make sure the patient or the nursing staff is doing frequent perineal skincare. We may need to use barrier creams, they may need to take a shower, moist toilets, anything we can do to keep that skin intact or prevent any breakdown from getting worse. For safety reasons, we want to answer call bells immediately so the patient doesn't jump out of bed and fall rushing to the bathroom. A bedside commode may be very useful for these patients. We also work very hard to treat the cause of the diarrhea whenever possible. Sometimes we cause the diarrhea by giving the patient too many laxatives when they're constipated. Sometimes we give the patients antibiotics for a totally unrelated issue, and the antibiotics cause the diarrhea. In that situation, we can't just stop the antibiotics or the infection will get worse. So that's why we try to treat the cause when it's possible. There are two main medications we use to treat diarrhea: loperamide or Imodium and diphenoxylate or Lomotil. Loperamide is over the counter, but it's used in healthcare settings as well. Loperamide works by slowing down peristalsis. This decreases the amount of bowel movements being had and also allows more time for the bowel to reabsorb water, making the stool less liquidy. Loperamide can cause constipation if used too much, so we have to watch for that. It can also cause a person to feel uncomfortably full and bloated. In some people, it can cause tachycardia and fainting. Diphenoxylate also slows peristalsis, but it's actually a controlled substance. It's a narcotic. It works to slow peristalsis as part of the narcotic effect, and it also works to dry up fluids in the body. This requires the patient to be well hydrated before taking it. It also has a side effect of severe constipation, drowsiness, headache, blurred vision, and dried mouth. We do not use this for short-term, non-complicated diarrhea. We use it when the patient has very symptomatic diarrhea and we need it to stop. We do not use either of these medications if the patient has an infectious cause for diarrhea or if the diarrhea is antibiotic related. Now, that doesn't mean that a provider cannot prescribe it for these issues. It just means that they shouldn't be used. There's one cause of healthcare-associated diarrhea that I want us to be familiar with, as it's a huge problem. Clostridium difficile, or C. diff, is a bacteria that causes infection in the colon. It causes diarrhea that can be life-threatening or severe damage to the colon itself. Unfortunately, most C. diff infections are related to antibiotic use. Antibiotics are great in that they kill bad bacteria, but sometimes they kill off the good bacteria living in our colon. When the good bacteria are killed off, the bad bacteria that are normally controlled by the good bacteria are allowed to flourish and grow like crazy, and this causes diarrhea. Some people carry C. diff in the colon and they never have any issues with it because of their good bacteria. But then one day they receive an antibiotic that kills off that good bacteria and bam, they've got C. diff. Other people will get C. diff bacteria in their colon by the oral fecal route, meaning they touched something that had contaminated fecal matter on it and then they got it in their mouth. And it's usually from not washing their hands after going to the restroom. There are healthcare associated strains of C. diff, meaning people in the hospital get this strain, but there are also community strains as well, and both are bad. These people get mild to moderate to severe watery diarrhea that has a yellow color and sometimes looks like it has seeds in it, and it has a very distinct odor. The type of smell you will never forget, and you'll be able to diagnose someone with C. diff based on the odor alone. Moderate to severe cases will end up hospitalized if they contract it at home, and a hospitalized patient who gets it in the hospital from the hospital may end up in the ICU and may die. They get severe dehydration, severe fluid and electrolyte imbalances that can cause cardiac dysrhythmias and kidney failure. The treatment for C. diff is actually more antibiotics, but very specific ones. We must also put these patients in contact isolation to prevent the spread to other people. C. diff has a spore-like outer shell, so hand sanitizer won't kill it. We must use warm water and soap to manually remove it from our skin. Hand washing and using antibiotics sparingly are the best prevention strategies we have in healthcare. We also need to educate all patients to wash their hands after they use the restroom, especially if they have any diarrhea. When we clean the linen or supplies from a C. diff room, we must use bleach. Bleach is the only thing that's going to kill the spores. And this is the end of part 3, diarrhea.